what we are talking about today is Fascia by Mateusz, but who is Mateusz? So Mateusz has 12 years of experience as a physiotherapist and personal trainer and has spent over 22,000 hours one-on-one with patients and clients. So I think just that number is already impressive on its own. He is specializing in posture, bodybuilding, and nutrition. He merges physiotherapy with training for overall health and body transformation, enabling people to achieve significant enhancement in their physical and mental well-being. Mateusz is a personal friend, and he is one of the best physiotherapists I have met in my life. And I'm not just saying because he is a friend, but unfortunately, I had the opportunity to visit so many physiotherapists in my life. And yeah, he really knows his stuff. So I think you guys are going to get a lot out of this session. So without further ado, Mateusz, the stage is yours. Please take it over, blow us away. And I'm very much looking forward to this.
Yeah, no pressure. Thanks for the intro. Thank you very much. Hello, everybody. So let me just share my screen so I can show you my fancy presentation that I made for you. Let's see. All right. Cool. So today I invite you on a little journey from point A to B. We're gonna look at our body from a totally different perspective, and I'm gonna share with you something I learned a while ago and then experimented with and played with for the past, I guess now decade or so. And it's basically the discovery of fascia. And what it is, we're going to dive into that in a second. But it's basically going to be a journey from what you know about body into a totally new view of it. And it will resolve a lot of mystery and questions. And I think it will enrich you and like your perspective on your body and your training and longevity and all those kind of topics. So it's going to be pretty cool, hopefully. We'll see. So first I'm going to present a couple interesting aspects, and in the end, like Adam mentioned, we're going to have a little Q&A session. So if you have some questions, just write them down and write them in the chat, because they will probably pop up. But I constructed this presentation from, like I said, from little point A to B, and I think some of the questions that you might have will be answered a little bit later. So with that, let's start. There we go. So in the beginning, I want to ask you a couple questions and challenge you a little bit in the way you think about the human body, all right? Because obviously in this community, it gathers people that are interested in health, and most of us had some experience with training, mobility, stretches. We have some idea of what does mean healthy lifestyle, good training, all that. So some of you, yeah. Some of you does yoga, some of you does weightlifting, powerlifting, CrossFit, all types of form of movement. But I have a couple questions for you to challenge you the way you think. So first of all, do you guys over here, do you still think that muscles have attachments? Like, for example, we have a bicep that goes from point A in the shoulder to the elbow, point B. And do you think that muscle is responsible to bend the arm? Do you still think like that? Because that's what we are being taught in school. So I want to challenge that today, all right? Second of all, did you know that your tongue is actually connected directly to your toes?
What?
Your tongue and your mouth is connected to your toes.
That's the smell.
That's the smell. Yeah. So that's another question I want to give you to kind of challenge, spark curiosity and how you perceive human body. Would you like to know how to remodel our skeleton, body posture, and resolve any tension or pain that you might experience? And also, mind you, we're talking about lifespan. So if you don't have any tension and pain now, the knowledge I'm presenting to you may be necessary in just 1 or 2 years or 10 years when your body changes with age, obviously. So would you like to know that? How to transition from bad posture to good posture, how to transform your physique? We're going to answer those questions, yeah? Do you want to know why tight hips can result in headache? That's an interesting one.
Oh, yeah.
Like, how come? Well, we're going to cover that, so stay tuned. All right, next one. Do you know that when you go to the gym, or maybe you do some bodyweight training like calisthenics or whatnot, do you know that when you train, you actually don't only train the muscles? And what do you train? like accept the muscle itself. And it's actually very important to know, because it can transition like from a person that is kind of like interested in training into somebody who's like, holy shit, I actually have to train a lot, because this will resolve a lot of the other issues we're gonna talk about. And did you know that in recent years there was a new organ discovered, and is as big as your human, as your body, basically. It's very interesting as well. So, what if I told you that the thing we're going to talk about today, the understanding of it, like better understanding of it, and the new perspective, if that would be implied over the whole of world, it would revolutionize our fitness, our rehabilitation practices, our treatments, at the best, at not only the best practitioners, but like normal hospitals. It would totally change the way we perceive fitness training and medicine, and that also includes doctors.
Recording in progress.
Yeah. So that's another. So a couple questions for you, basically, to just spark curiosity, and yeah, we're gonna answer all of those actually in this presentation and more. So, you guys ready?
Yeah. Yes.
Hell yeah! Let's go. Let's dive in. And also, by the way, if you don't like skulls or like those kind of pictures, then yeah, I guess this presentation is not going to be for you, because there's going to be a lot of tissue and skeleton kind of like images and graphics. So yeah, some people don't like that actually, which is funny to me.
Close our eyes.
Yeah, exactly. I will tell you to close your eyes. All right, cool. So agenda for today. So we keep things clear. How we're going to do it. First of all, I'm going to challenge your perspective, which we already started doing it. So I'm going to challenge your education and the thing you know about our body, and also how you can apply the new knowledge for your greater health, and as well explain how this presentation, if you will use this knowledge in your real life, that how it can save you a lot of money in the future. And I know what I'm talking about, because for the past 12 years, I've been receiving a lot of money from a lot of people to fix their problems, to fix their posture, to fix their pains, tensions, all kind of issues with the body, but also, training them properly. So today we're gonna a little bit like, tap on this big ass topic, but basically give you a little bit like inspiration to dive deeper and yeah, use it in your daily life as well. So we're gonna change our perspective. That's first of all. Second of all, we're gonna challenge the old theory of anatomy and biomechanics, and we're going to confront it with new research and and new practices that actually works and are significantly more effective. We're going to talk about this new organ. So we're going to discuss what is fascia, what exactly is it, so you understand what we are talking about. So that's going to be also cool, because from there we're going to teach you about what we call myofascial lines. Okay, fascia creates myofascial lines. We're gonna take a deep dive on what are those, because you are literally made out of those. This is the best part of the presentation, where we start to explain how is it that tongue is connected to toes. How is it that if you crack your toes, you're suddenly able to go deeper when you do the front lean, like you want to touch the floor. Suddenly you're able to go deeper, like 2-3 centimeters, just when you crack your toes, right after. So how does it work? How is it all connected together? And we're not going to dive in all of those lines, but we're going to cover the main ones and give you some examples that you actually might be like, holy shit, actually that applies to me. So that's going to be cool. All right? Yes. And next one will be the practical cases, like I said. We will also give you a couple exercises, a couple moves that you can do on your own. And yeah, so you can actually use that knowledge. And we're going to try to have it fun, yeah, as we entertain and educate. That's my favorite style. Educate, entertain, have fun. So, but like I said, keep the questions for until the end. Just write them down in the chat. And yeah, with that, let's start. So, first of all, who am I? You already heard a little bit introduction from Adam about me, but I'll tell you my story in terms of my experience with fascial system and this journey that led me to becoming a little bit specialist on that subject and implemented that in my life and in training. So this is me breakdancing when I was, I think, 10. I thought I was super cool and hot shit, definitely. You can see my bike. It's probably not my bike, but yeah, I think it's a cool picture. But The reason why this picture is here is because it's just a couple of weeks before I broke my back and crushed my foot at a pretty young age. I don't really remember how old I was. I think I was like 14, maybe 15, but it basically led to a lot of pain, to trouble with sleeping, weak body. I was not able to dance anymore, so that was like a personal tragedy, and basically it wasn't fun times. I had an injury when I was doing some acrobatics. But that also led me to get fascinated by the methods that they brought me back, how they healed my spine, how they recovered my foot, how they gave me back my strength, my functionality. And from there, it went forward on. Like I went to take the master's in physiotherapy. I started manual therapy practice. I discovered the fascia and did like about 20 courses around that subject, transitioned to personal training, and then continued next years into training with multiple clients and using all those methods. Cool. All right. So strict to the business. This is the best part. So like I said, there is this little disconnect between what is actually real and what is still being practiced in most of the places, like most of the doctors and therapists and practitioners, like chiropractors. Like whenever you go and grab a massage to release your tension, wherever you go to to chiropractor to crack your back and stuff like that, like a lot of the practitioners are still using the old frame for how our body works. So over here we the old knowledge basically says that the fascia is just a filler. So it's basically a thin, like, you know, when you cook a chicken and you kind of like take the membrane off of the chicken, the white stuff that is like, you don't really like it. It's like, that's icky. I'm going to cut this thing off, the white membrane on top of it, the little fatty thing. Like that's fascia, right? Or one of it. Because we're going to learn in a second that there's not one fascia, but multiple different fascias. So that's also going to be a deep topic. But basically, old knowledge and old practitioners, aka medieval butcher approach, which unfortunately is still present in practices and even in hospitals, tells you that fascia is just basically like a filler between muscles, bones, and nervous system and organs and everything. So it's basically like a stuff between other stuff. That's the old knowledge. And it's also the same knowledge is, like I told you in the beginning, do you still think that muscle starts in point A and leads to point B? If so, then you're still kind of like ingrained in that old type of knowledge where we think that body is basically, a separate parts working, separately from each other, and they have little to do with each other, or at least not that much, really. And the result of that thinking is inefficient treatments, unnecessary operation procedures. Like me personally, from my experience, like me working with some of my clients led to them not having to have like a surgical operation, which is I think super cool. Like if you have a patient or a client comes to you and you kind of prevent the operation, and they're super grateful, like that's the best feeling ever, really. Like some kind of damaged knee or like shoulder or a carpal tunnel in the wrist, and you can prevent that. That's very, very interesting. And fulfilling and awesome, and people are ecstatic. So, but that's why they also are happy to pay a lot of money. So save yourself money and make notes and learn yourself the new ways. Yes, and also that influences the training. So how do we train the body? When we go to the gym, that also that old way of thinking. I'm going to train chest now. I'm going to train quads later. That way of thinking is also not fully correct. So we're going to challenge that, and we're going to meet today a bit different angle to that. First of all, you guys need to learn that fascia is not a dead stuff. It is actually a very alive substance. It is almost, you need to think about it as a second nervous system. And it's fairly new knowledge, not more than 20, 30 years, that knowledge actually exists. It is still difficult to research it, as fascia, like when a human body dies, about 15 minutes in, the fascia changes its structure. So basically it dies very quickly. And it solidifies itself and mineralizes, and it doesn't have the same features. So it's difficult to research it, as experimentation on a live human is limited by human rights, probably. probably from a good reason, but basically, like, yeah, that's the reason why the research is still. I mean, right now they have new methods, and they are able to lead like a camera into the body as somebody is still alive and see how things work. So that's going to be cool to talk about. But basically, just to understand, fascia is a very alive organ, and it's also like a second nervous system for our body. And what it means. So I want you to do a little experiment, okay? So everybody close your eyes for a second. And reach out with your arm in front of you, like, you know, raise your arm in front of you. And then squeeze the fist into a fist, like squeeze it tight. So what you're experiencing now is you're able to tell me, or rather you are aware where your arm is in space, even if you don't have the visual, if you don't have the visual signal, your brain knows where that arm is. And if you will try to move the fist to the right, for example, let's try to do it, you know exactly how this arm is moving if you start moving, even though your eyes are closed, okay? You can open eyes now. So that feeling of awareness of where is your body parts in space, that's proprioception. And fascia plays a huge role over here. It's not the nervous system itself, it's the fascial elements, this little gooey, weird membrane kind of substance that is connected with nerves and brain, and it acts like a secondary nervous system. So it's very interesting actually, and it changes totally the way we're going to treat the body, the way we're going to heal it as a doctor, as a manual therapist, as a chiropractor, as a personal trainer. It changes everything. And it's also very connected, so it goes across our bodies in all types of direction, which we're going to learn in a second. And yeah, it influences much more than we think, so it's fucking cool. Now, like I said, it's a complex connected system. Yeah, that connects multiple points around our body, not from point A to B, but rather creating a network of, like, if you think about like a spider web or a sailboat with all the different lines, ropes, connecting one system into this one kind of tension-like structure. This is how we are built actually. Not from blocks, but rather from this tension system. So what's the result of that kind of thinking? Well, first of all, it's correct. So that's nice to have. And it also helps to develop much better treatments, much better training programs. It helps to avoid surgical operations, some of them at least. And limits drug use. And overall, if you would do like a statistic of all the money that goes into healthcare for people that have pain, for example, headaches or neck pains or lower back pains or elbow pains, and the type of medicine that people take and all that stuff, if you could avoid that or limit that, that would literally revolutionize the world as we know of. And that type of knowledge that we're going to present over here is actually the base, the foundation for all those like treatments. So it's very, very cool, very interesting. All right, you guys follow? Cool. Let's go forward on, yeah? So exactly, what's fascia? Like I said, it's basically the definition, if you would like search it, the shortest definition you can find is a thin layer of fibrous tissue enclosing our muscles, nerves, and bones and organs. But that's not only that. It's also, like I said, it's an element of proprioception. So basically the capability of our body and brain to know where are we in space. So if you close your eyes or you're in the very dark room and you move forward, you're trying to find the doors, for example, fascia is the element that helps you to basically organize information from your body parts into the brain and allows you to move around. It's not going to be perfect, but that's the thing you're using to actually move around, because there's no visual signal, right? And also nociception, that is the sense of pain. And that part is also very interesting because it's not only the nerves in itself that have those receptors, but also parts of fascia, or myofascia, so blending of fascia and muscle fibers. That's like a substance, you need to think about it like it's like a venom kind of creature. So it almost thinks on its own. It can tense up, in a sense like protect different body parts, and it informs also brain about tension and pain. So that's nociception, so also very cool. Yes, and by many researchers it is also recognized as a new organ. Not everybody is down to that, for that, but yeah, most of them are. And apart from that, like we already mentioned, it's also a very complicated but very interesting system of ligaments, bones, tissue, pockets that you are literally made of, and that creates this beautiful structure around our body, where our bones are those firm, stable kind of elements, like you would say a mast on a sailboat. If you imagine those old like sailboats, you know, Columbus on a boat, and you have this mast, those are like a bit more strict, stable, those are bones, and you have all those ropes and sails, and that's fascia basically, and muscles, right, together. So fascia is a big part of that. Even though you cannot say really muscles without incorporating fascia already as the pocket that the muscle is in. So there's no such thing as muscle on its own. Muscle on its own would be like minced meat laying on the table. It's just total mess. So fascia puts that in pockets and and stretches it around our body, creating the tension, and also it's a communication organ for our brain, like a secondary system for information. Cool. So, like I mentioned, fascia, it's not a one thing. So you cannot think about it as a ligament, or you cannot think about it as a tendon or one thing. It's different things. So it has fascia is the general name, and then we have all types of fascia. It's like a spectrum, going from honey-like gluey and wet substance, which every time if you would squish between your fingers, for example, it would be like honey, so it would change itself every time. And that thing, it's filling every space between our muscles, so causing, for example, that if I do that with my forearm, so if I twist my forearm, it is possible. Everything is lubricated, and everything is possible to glide on each other without irritation, without inflammation. And that's actually the reason why, for example, if we have incorrect tension in our body, when the irritation comes, inflammation comes, it comes also from that elements not having the correct tension, which we're gonna learn about that later. But basically, fascia goes from, on a bigger spectrum, from very wet, gluey substance, so it's basically glue that literally puts us together, into a little bit more firm elements, like a little bit that kind of membrane, or like I mentioned, like this white thing on top of a chicken that you can peel off or cut off, and that kind of like encloses our nerves, muscle fibers, organs, even bones. It's inside our brain, it's inside our eyeball, everything. So not knowing that actually changes the way you treat body, like I said. So that's actually very important. And from there, it builds itself into even stronger elements. So ligaments, tendons, even stronger. Myofascial lines, we're going to explain that in a second, what that is. What basically like a combination of muscles and fascia, like I said, that creates our function, enables our function. So it basically goes from like very wetty kind of ever-changing venom-like substance into a little bit like pocket kind of system, membranes, that kind of layers, into ligaments, tendons, bones, and myofascial lines, and as well into a bone. You can think about bones as demineralized elements of fascia. So it's basically like a hard thing, right? And all of that is connected into one system. The picture in the end you see, it's not muscles. This is basically like a little try of putting fascia all together, how you would look if you would peel off everything else but fascia. So this is you. Not very pretty, I guess. But yeah. All right, cool. So until now, among others, of course, because there's more systems, but you can definitely recognize, nervous system, cardiovascular system, lymphatic system, skeletal system, muscular system, organs. But now we need to begin to recognize also another organ, which is fascia, the connective tissue with organ-like properties. Fascinating thing, actually, when you think about it. All right, so we're going to switch a little bit now perspective about the human body. So we're not going to think that that our body is basically muscle from A to B, right? It's like a mechanical, like a robot, kind of like, now I'm lifting my arm, so that must be bicep. Now I'm bending forward, so that must be, like a hip flexor. It's much more than that. Everything is connected way much more than you think. So always think about like tongue and toes. kind of comparison. All right, so we look at our body now a bit differently. And I want you to stop thinking about human body as 600 separate muscles that you can, for example, train separately or treat separately. Because in reality, it's just not like that. It just doesn't work like that. So for example, to give you like a picture or a metaphor, if you would be on a boat, and let's say there's a storm, it's a sailboat, and the sail is very important that you have it intact, otherwise, you'll be lost. You need to have the proper tension around the sail to steer it, to have a forward momentum, to have control, and for the sailboat to not break. If one of the lines on a sailboat has too much tension, then it stresses all other elements in the boat. So if one side of some kind of line has too much tension, it's just too tight, then the rest of the lines may actually may broke, and the whole boat might fall into pieces. So this is an example, for example, when you sprain your ankle or break your ankle, and then years later you go to a therapist like me, and I ask you directly that question, and you're surprised if you hear from me like, when was that you sprained your right ankle? When was it? And you're like, I didn't tell you that I sprained my ankle, but like, yeah, but you have tension on your shoulder blade in the back on the other side, and it's like, so when did you damage your ankle? And you're like surprised, how does it work? But it works like that. It's a boat. The tension needs to be spread around, otherwise it will produce bad results somewhere else. Yeah. So we don't think about human body 600 muscles. We think about it's one muscle connected with everything, but it sits in 600 pockets. Right? Cool. Cool. All right. So tongue is connected through different bonds with toes. And you can check it out, this picture on the screen right now. And you can see over there a little description, yeah? It's a little bit nasty, I know, but this is how we look on the inside, sorry. So you can see that the tongue, through this tissue, through fascial tissue, muscles and fascia, connected, spreads itself, connects with lungs, connects with diaphragm, and other elements. It goes through your hip, from your back to the hip flexor, right, into your inside of your leg, and so forth until it reaches toes, which is crazy to think about. But basically, if you would have a dead human, you could peel off that kind of layer, and it's all connected together. And in our body, there's multiple different bonds like this that goes and basically twists itself on top of each other, explaining also later how the tension travels around our body and straight lines and spirals across, inside and out. Like basically our body is like do you know that that kind of activity that some people do, that they put the rubber bands on top of a rubber band on top of rubber band on top of rubber band, and kind of create like this big ball of rubber band until it implodes? That kind of, it's almost like, some of it at least, that kind of metaphor could apply to our body. Yeah, cool. So we have a different type of bonds, like I mentioned, and knowing those totally changes like the perspective on how we're going to train you, how we're going to fix your issues with tension, pain, posture. We are able to actually increase your strength and in much more efficient manner, because we can pick up on the stuff that is inefficient, that blocks your strength, for example. So let's say that you're a male or a female that is an athlete that throws something. If we can find out that in your posterior chain there's in one of the bonds in the back there's some insufficient area that is just you're not fully connected or not strong enough, then we can improve your efficiency at throwing that thing. So we can improve you as a human being, basically having that knowledge. If you don't have that, then suddenly it becomes totally like a dark screen, and we again look at the body from like just like only parts, which is just not how body works. Cool. And one example for you that maybe some of you can relate. All right. It's a very simple like a comparison what can happen to you, right? So if you sit a lot, and let's be honest, we all of us sit a lot, but let's say you don't train and your genetics are like that, so that you are not hyper mobile, then you will have and you will develop tight hips, so tight hip flexors, abductors, and your body will start to rotate automatically the pelvis forward, so anterior tilt basically of pelvis, That will create tension in the lower back. It might be felt slightly, it might be like a belt of tension, and might be pain. That tension will travel up the back. By the way, it will also disconnect your core muscles, so now training abs is difficult or impossible almost, and also increase the risk of getting disc like herniated in your back. That also travels, the tension from mid-back travels to neck, so pushing your head forward, making you look like a goofball, and also stressing your neck and shoulders, and in the end can actually produce headache. Because I don't know if you know, one of the bones, like did you know, for example, that your calves are connected with your forehead as a one line?
Who doesn't know this?
Right? And that also explains why, cracking your toes will also allow you to lean more forward suddenly when you crack them, because you release certain tension under the foot that is connected to belly, to the Achilles tendon and the belly of the calf muscle. Then it's connected as well with the hamstring, and then goes up the body, travels back neck, and actually the fascia goes around our head like a helmet, like a very tight swimming hat. How do you say that? Like a cap. And it basically ends on top of our eyebrows over here, right? And the reason behind this is that many thousands years ago, we used to not be humans, but we used to be something else. And according to that, way of thinking, school of, evolution, we used to be some kind of creature that goes a bit closer to the earth, with the face close to earth, while the back was a bit more strong and less receptive. So for example, you can think about like a crocodile. The top of crocodile is very hard, and his top of his head is also kind of his back, right? So we evolved from that. So in a sense, our back finishes on top of our eyebrows over here, and below over here there's different structure, and that's why the face muscles, they have their own kind of world except for that. But basically this is how tight hips can produce migraines, headaches, and tensions around the head, either on the side over here or in front. So that's also kind of cool to know. So yeah. And yeah. Yes, so when you are at the gym, when you lift heavy stuff, for example, it's not only muscles that you are training, you're also training tendons, fascia itself, and how it's connected. It's a basic connection with the brain, so, as well as nervous system, hormonal system as well, on a bonus. So it's not just muscles that we're training. So everybody who is thinking like, I don't need bigger muscles or something like that to be happy or whatever, it's actually way much more. And the more and more research shows that it affects actually, our mental performance and so forth. So even if you don't want to train for aesthetic purposes, like just the health, like it's so crucial to actually lift and test this tension system to make sure that all elements are evenly connected and evenly tensed, because you will, whether you choose it or not, you are affecting your body with your everyday lifestyle. So it's not a choice. Even you not doing something, it's actually doing something. So you can either choose basically be passive and explore the world of pain and discomfort in your older age, or you can do something about it and train. So yeah, another question for you guys that will challenge your thinking. All right. You probably know that going to gym grows muscle, or training with your body weight. It doesn't have to be gym. Myofilaments in muscle, they grow already after 3 to 4 weeks of resistance training. First, there's a little bit of adaptation from the nervous system. So it looks like you're getting super strong, but it's actually the nervous system that learns how to use the muscle better. But after 3-4 weeks, you're actually starting to develop some more tissue. The muscle actually gets damaged, it gets reproduced, regenerated, and it grows. So that 3-4 weeks. But as you can see on the slide, some fascial elements take up to 9 months before they're fully transformed. And that's radical if you think about the training, because if you are new to the gym and you can just train and you're seeing the super quick increase in strength and capabilities, and if you just proceed to train and upgrade the weights and everything very quickly, you may develop issues with a lot of body parts because your fascial system just doesn't keep up in the same way. So the softer elements, yeah, they can adapt themselves very quickly. But the harder elements from fascia, like you remember on the spectrum, we have different types. So the harder elements, they do not adapt as quick. So you will develop irritation problems like discomfort, pain. You may rupture a muscle or partially rupture it. So basically like overstretch in a sense. Yeah, you can even damage permanently body if you, for example, lift too heavy and yeah, you get herniated disc prolapse, and that's the rest of your life. You're basically, yeah, you have to deal with that. So it's that kind of knowledge about fascia. It actually changes the way we train as well. So that's why we sometimes will limit people with their progressions with strength training on purpose to make sure that they actually have full control over the body. So that's yeah, that's also good to know. Yeah, we got a question.
Hello. So it takes up to 9 months to like transform it, but how long does it take to damage it? Like, is it fast?
1 second.
Okay.
Yeah, you can
So
tear a tendon immediately.
Okay, but then it takes you 9 months to rebuild it.
No, then sometimes, yeah, sometimes you never rebuild it, sometimes it's never the same. So yeah, if you rupture a muscle away from your body, it might not be the same anymore.
But can you still like protect it in some ways?
Yeah, with proper training and like gradually increase, yeah, with like the correct basically progression in your training, you can do it, yeah, by being smart, not being dumbass, and you know, lifting too quick, too heavy. So yeah.
Okay.
Yeah.
Thank you.
Cool. All right. So yeah, yeah, exactly. This explains why a lot of people have, you know, issues while starting training and progressing. They basically cannot keep up. Their tissue cannot fully keep up with their muscle strength. So your muscles are basically stronger themselves, in some cases, or your body is able to lift some stuff quicker than you probably should, or it should be adapted to what you're doing. So, for example, too much of certain exercises will also tire off the fascial elements. You will cause irritation problems and so forth. All right? Yes, exactly. Inflammation, irritation, pains, discomfort, herniated disc, and other fun stuff. So if you want to have inflammation in your body and those kind of pains, then just disregard that and train super heavy, super quick, and you're gonna be good. So another thing that we need to know, it's not only training, it's also bulletproofing your body with correct mobility exercises and correct functional strength exercises that are directly designed to increase the stability in shoulders and the strength of the ligaments as well. So it's not just like you can, let's say, take it slow or something like that. That's not what I mean. There's just specific exercises for specific joints to make them stronger. But it's a whole presentation on its own, and we're only going to go there if you have specific question about specific joint. All right? Cool. Now, let's learn about the next thing. So far, do you guys more or less keep up? Yeah.
So far, so
Great.
good.
So far, so good. Awesome. So now we learned that there's this thing called fascia. Now we also learned that it's more alive than we think. It's actually much more important than we think. And by the way, like a side note, it's even in our eye and brain. And if you ever have issues with the fascia, it may also affect, in a sense, those organs or those elements. So yeah, it's literally everywhere. If we would over here sit and we would remove from you all the skin and organs and muscles and bones, you would still be here in more or less the same shape. You would look a bit weird, but you would basically, your shape would be still here, and you would be able to recognize each other by basically just the frame and shape of your bodies. So that's how extensive that network is, right? Cool. Now we're going to talk about a little bit where do we go from here. So now we know more or less that there is this thing fascia, from softy kind of like gluey substance into a bit more hard elements. Now we're going to talk about those myofascial lines. So what it is, so how does it connect? How does tongue connect with toes exactly? So as you see on this picture, for example, over here, we have example of superficial back line, for example. And just keep in mind that there's multiple different lines. We're not going to discuss all of them. We're just going to discuss the main ones that are the biggest, chunkiest lines that you might want to be familiar with, all right? So this line runs from under your foot And like on the previous example, right, it connects with the Achilles tendon, with the calf muscle, with the hamstring, goes back over there to along the spine, and it's actually mentioned over here over the head to the brow region, like I told you, right? So all of this is basically like a crocodile almost, right? So this is the back line. We have another line that is in front of us. So you can see the neck muscles, the fascia on top of your rib cage, your kind of like your abs basically. So basically it goes on top of your front side of your hip, and then it kind of connects itself with the pelvis in front of it, and mechanically, in a sense, it also influences those hip flexors and the fascia above the legs. Kneecap goes forward on top of your foot. This is the front, superficial front line. We also have a deep line. We also have lateral lines. So this line goes on the side of your body. So again, like think about it as a sail on a boat, right? So we are the boat. The bones are like a mast, and like the lines this is what we're looking. The blue element on the picture. It's not really blue, but on the picture it is. This is the sail. This is those lines that lead to the sail to help to navigate it more or less and create that correct tension. And any disparity with tension, any problem with the tension will result in pain. Tension, maybe broken, torn ligaments, and different issues. So this is lateral line goes on the side of the body. We have spiral line as well. This one is very interesting because that one allows us to walk, to throw things, to run, that kind of good stuff. So basically it's more like a spiral around our body, as you can see. So it basically connects in a funny way one foot with another, but first travels up around your body in a sense. It's very cool. So those allows the rotations in your body, right? Obviously multiply that with the muscle strength. We have arm lines. So those are connected. Did you know, for example, that insides of your palms are connected with each other? So if I would peel off fascial elements in my fingers, I would take them away. I would slowly go to my chest and to the other side, and everything over here is connected. And that's a good example, for example, on how to stretch correctly. So, for example, if you stretch one side of your chest, let's say I need to stretch my chest because I'm a little bit stiff in my chest. So I'm gonna lean against the wall and just stretch that one part. What most people don't realize, and even including trainers and some therapeutics, that while you do that, yes, you do stretch chest in a sense, but you also kind of move around this fascia over here in a sense, right? It's not the most effective, but if you would stretch both hands at the same time, then you're stretching the bone on both ways, not only one way and move it around, but you basically stretch it from both ways, and that is way much more effective. So that's a good example on how this knowledge can be applied in real life. So if you actually want to stretch the fascia around shoulders, because your shoulders are in the need of that, then you would be more efficient if you would stretch both of those at the same time. So so those are arm lines, for example, and deep front line. This one is deeply connected on the inside of the body. This is also the place again for this story about tongue and toes. This is deep within us, under the organs. So this is the deep front line. And there are other functional lines. We're not going to cover all of that because it's just too deep, but you now know that we are created by those lines. Couple that with muscles, and now we are beginning to have the proper image on how your body looks and works. So next time you have shoulder issue, you start to understand that it is actually connected also with your knees or your hips or your feet, and what you can do about it. Thing is also that sometimes you have a tension or a problem in one spot of your body. Let's say, give an example, the foot, but it will show as pain in the knee, for example. And if you go to somebody who doesn't have that knowledge over here, then they will treat your knee. So you will get a physiotherapeutic kind of like treatment toward your knee. Then to release the pain, you will get a massage. You will get all types of magnetic treatment, maybe some temperature, all kinds of stuff. and it's going to be treated over there, but maybe it's actually not the right place to work on. Maybe the real deal is actually to fix that foot, not necessarily the knee. And that kind of like example, there's plenty of examples where you have an issue, let's say tennis elbow, you try to go and you get the therapy on the elbow itself, while the real problem lays somewhere else. Where basically your grip muscles, your strength of your hand is the cause of a lot of those issues. So not necessarily the elbow itself. So yeah, cool? Yes, so now we're gonna try to put it in practice, okay? So now you know what fascia is, that it's way much more complicated and organic and alive kind of like thing that has different types. And that it creates those bonds that goes around our body that actually allows us to move around and utilize different movements. So when we treat patients or when we train a client or when you train yourself, then you need to kind of understand those, or at least be aware of those, that everything is connected. So next time you have tension in your back, think about actually, are your hips mobile enough? Because oftentimes the answer actually lays there, right? So let's now go through some common issues with disorganized fascia. So disorganized meaning that their tension is not, well, organized. So one side is just too tight, or one side is too weak, right? Because sometimes, for example, most people, in general, the back chain, the back line is too weak because we sit too much. We don't hang from a tree anymore. Like monkeys, we don't lift heavy, most of us. We don't climb. We don't do any of those movements. And then we are surprised that we have tension in our neck, headaches, belly that sticks forward, anterior tilt of pelvis, problems with the knees on the inside, pinching under the shoulder blade, for example. All of that is connected to, for example, just not strong enough back muscles and back chain in general. So both fascia and muscle, you need to think all together, right? Lack of proper movement, resistance training over here, that's what it means, and inefficient lifestyle may lead to tension in lower back. So let's go through those questions real quick and think about, have you felt that ever, or have you heard somebody complaining about it, right? So for example, tension in lower back, like a tension belt. I mean, I think everybody heard this one. My lower back feels a little bit tense. Well, no shit. You sit on your butt for 10 hours, you don't lift, you don't hang from a tree like a monkey. You're built like a monkey, but you don't move like that, so now you deal with that problem, right? By the way, do you know that your shoulder construction, the design of your shoulder, it's still designed for hanging from a tree, or like swinging from a tree in a sense? And not doing that causes a lot of trouble and basically pinching in front, like inflammation in the bicep, improper like position of the shoulder blade, pinching in the back of the shoulder blade, neck problems, elbow problems, so weak grip, but certain movements will damage your elbow, and so you get that issue with that. All of that comes from just not acting like an ape, which you should, in theory, because you are that in a form, just less hair. True story. Anyway, if you are unable to perform squat, deadlift, or any like a bit more complicated compound movement, have you ever tried, without discomfort, or maybe you had problems with activation of the right muscles, right? This is still a problem of disorganized fascia. Some of the elements are too short, too tense, and some of them are too weak. And maybe it's not even the activation between brain in that area is not even there. So basically you have no idea how to move your body around, which will result in eventually in, if you're unlucky in an injury, or when you get older, you will get slow. Like some older people are like all hunched up and they move slow with your feet, very slowly moving around, slow in their brain. Like that's one of the reasons also why you definitely should mobilize and do weight training, for example, to avoid that kind of stuff. Like if you ask me, I want to live to like at least 90 with, ripped, nice physique, capable, jacked, but also functional, right? Healthy. There's no other way around it. By the way, did you know that there are those groups of people, these areas on a planet where people live unusually long, right? You have, I believe, somewhere in Japan, you probably know. Where's that?
Yeah, the blue zones,
Okinawa.
Okinawa,
Yeah.
and
Norway as well. A lot of people live quite long. Do you know what's common among them?
they move.
They move. They do tai chi, they do walks, they do hikes, they do something moving around. Guess what? You guessed it, fascia. Just making it nice and tense, making sure that all elements kind of like are in the movement, and they don't allow it to kind of like stiffen, right? So that's a good one to think about. And since this presentation is also presented to limitless people, this is the hack. The biohacking hack is basically, implement that kind of movement. And it sounds so obvious, but like, do you actually do it on a regular basis every day or not? And the older you get, the more harder it is to go into that rhythm. So yeah. Anyway, if you have issues, I know Jake has, or she asked me at least about it, that the abs or belly in general is kind of sticking forward on. So you kind of think that I'm a little bit too fat or something like that. It's not always like that. It's sometimes it's just the positioning of your skeleton that leads to that. So but that also leads to not being able to contract abs. So for example, if you train abs and you're unable, Adam.
Yeah, I have that.
Yeah. So if you're unable to contract abs, for example, not engage core, which by the way results in higher risk of herniated disc and overloading of the spine. That one of the reasons may be anterior pelvis tilt, where the belly sticks out. And it's all reason behind it is basically too tight muscles, the hip flexors, the abductors. You don't fucking mobilize enough. You don't move enough. That's the reason. Anyway, yes.
So is the fascia different in women's body and men's body then? Because I feel like what you just said, like abs just like sticking too much out, I feel like women are way more like bloated and stuff like this. So is it different or?
So first of all, there's a difference between individuals. It doesn't even matter the sex.
Okay.
But it's different for females and males. Well, first of all, females have different blend of collagen, and it is also affected by menstruation. And also when you have, for example, a kid, when you're pregnant and when you're giving birth, your body produces a different mixture. So basically your joints are starting to be much more mobile and flexible around when you're going to give birth, and it will continue to do that for a month or two later. So you'll be extra flexible in your hips, right, for the kid to get out of your body in a sense. So that's, definitely there's differences between genders, but the fascia itself and genetic potential is also different. So one guy can be very stiff, just always stiff. It's super difficult for him to mobilize the body, and it's just his genetics, his mixture of all the elements that makes the fascia, more mobile or less, all the tendons. He will just have to do way much more work to actually make him mobile, while others are just naturally more flexible and even to the point of hypermobility. So so there's differences and nobody's the same.
But even if you're a woman, you can train your fascia and then it's going to help, right? Either way, you're a woman
if you're
or
a human
man.
being,
No,
So
just human being.
So women too,
Okay, thank you.
No, but I'm joking, but everybody. Cool. Let's go. Do you ever experience, for example, again, let's follow this train of thought. So have you ever experienced pain around your knee, either on the inside or the pressure on top of your kneecap? It's a bit maybe a little more specific, but that's also a problem with disorganized fascia. It's basically the quadriceps muscle, so the thigh muscle, the front big ass muscle in front of the leg. This one is just simply too short. Maybe there's an anterior pelvis tilt, and the muscle is just too short, so it generates more pressure on top of the knee because it attaches itself. It goes above the kneecap and forward on down. So basically, if it's too short, then it puts a lot of pressure on the kneecap. So this is how you can basically damage also your kneecap if you don't fix that, because basically that pressure will use the kneecap on the other side way much more, for example. So over here we would mobilize the quads with roller and with proper stretches to fix that. Another issue can be, for example, you do not connect with glutes while training. That would be probably mainly for women an issue, since boys never train glutes. Which is wrong, by the way. Boys should definitely train glutes. Makes them more attractive like Adam, but also is very...
I've been working on it.
I noticed. Noticed. Pay attention. But also it's very important from perspective of function. Actually, glutes and lower back is one of the most main points of crossover of all the pathways to fascia around our body. So it's super important actually to train glutes, lower back, and core. Way much more important than people think. But yeah, unable to connect with glutes. Why? Well, one thing is obviously poor technique and lack of knowledge. Obviously, that's one of the reasons. Fascia doesn't have to do. Disorganized fascia doesn't have to do anything with that. Sometimes you just don't know how to train, or didn't learn yourself to activate it properly with the right, drills. That's one thing. But second thing is in this case over here is more about again, for example, the posterior tilt that doesn't enable you easy to squeeze those glutes because your belly just sticks out too much. You have too big arch in your lower back. And me, especially training with women, I've seen that some of them has this issue that they have not yet learned to activate glutes because there's so much pressure on the lower back. And when they, for example, perform exercises like squat or a hip thrust, the full tension and activation goes to the lower back still instead of glutes. So yeah, the solution over here would be to definitely make sure that the mobility is there. So deep squats, stretching the abductors muscles would be a good start. But also, so making basically sure that the hip mobility is there, but also learning to retract kind of belly in. So basically suck in the navel into the belly, rotate the pelvis back, right, and squeeze down the glutes. And learning that movement will then help to actually learn how to activate it. And one of the good ways to do it is just stand and do that. So belly in and rotate the pelvis back with your mind, and then squeeze the glutes just to kind of start to find them. And then second thing would be to do hip thrust, but no weight, just with one leg up, and with one leg obviously lifting whole body up. And then you try to find it again and do the same movement where you rotate the pelvis back and squeeze the navel in. So then you find kind of that glute over there. And with a bit of practice, you manage to eventually find it, for example. Cool. Girls, have you ever experienced that problem with connecting with glutes while training? No. Okay. Cool.
I'm not sure, so I will be well aware of that problem.
Yeah, maybe you didn't. Maybe boys.
But
maybe
this
not.
is the thing what you mentioned is also what they also do a lot in Pilates, squeeze your abs and rotate. This is the main position of Pilates, I guess.
Again? Sorry.
This is the main position.
Yeah.
You the powerhouse, activate the powerhouse. They call it.
Engage core.
Pilates.
Yeah. Cool. All right, let's proceed. Maybe you're tired around neck or have low energy. That also may result from the same problem, disorganized fascia. So over here, for example, if you are experiencing super extra tired, you don't know why, you have tired neck, you have low energy, generally, not the best mood. There are different reasons, but maybe one of the reasons again is tight hips or a tight chest. Females especially have tendency to have rounded shoulders, disengaged middle back if they don't regularly train weightlifting or some form of proper body resistance. So that basically the shoulders will fall slightly forward, rotate itself. They disengage chest, disengage the back in a sense, and then everything grows together, which then produces the situation where the head kind of falls forward and then creates tension to the neck and then to the side of the head and similar. And that can affect the mood, energy levels, can produce headaches and stuff like that. So again, weightlifting, mobility routines is the solution. and very good ones. Like, and in the end, I will like guide you basically through a couple of movements that just doing those, like literally just doing those are like the cherry on top of like, yeah, you do those and you like have the bulk of effect. Yeah, the most effective little routines that doesn't take forever, but it does take some consistency. So yeah. All right, yeah. Headaches, side of the head, front migraine. It's we kind of covered it right now. Maybe you have pinching. Boys. Now, thanks for the boys. Boys benching a lot of weight, doing a lot of push-ups, having pinching in front of the shoulders, right? That also comes from not enough of training of the back muscles, middle back muscles, wrong rotated forward shoulders. So, have you ever been to the gym and see those guys that are super big and their shoulders are like this?
Yes.
Rotated forward. And they look dangerous, they have problems breathing, right? Yeah. That kind of breathing. They think they're dangerous to themselves though, but not to others. And yeah, it's then common also issue with them to that they have inflamed bicep muscle. It can result in more complications, even frozen shoulder kind of stuff. Actually, especially females. How we would solve it? Stretch chest, stretch the tendons, or rather the fascia that lays in front of the shoulder by, for example, laying on a bench, holding a little bit of weight on a bench that is like incline, holding a little bit of weight and allowing that to stretch. That's one of the things. Second thing, you need to make sure that your middle back and general back is strong. So any type of rowing where you squeeze the middle part of your back, lift, like deadlift kind of exercises, also pull-ups or some variation of that, so lateral pull-down, for example, or dragging your body up to a bar if you're hanging below it. All of that kind of fixes those issues. Not only that, but that's one of the angles. You also need to train what we call a rotator cuff. You guys probably heard about rotator cuff? No, yeah, you did. Rotator cuff is basically a group of muscles that rotates your shoulder, to put it simply. And without going into detail too much, it's basically you need to train that rotation slightly with certain exercises, and I have two for you that we can mention in the end that basically solve the issue with rotator cuff. But yeah, this is what you need to do again. This is for you to like introduce you to the concept that all tensions and pains and issues with body, or maybe not all, but most of them can be actually resolved if you know what you're doing. So yeah, rounded shoulders, we kind of covered that as well. Sticking out shoulder blades, or flared out ribs. Again, ladies, a bit more prone to do that. So sticking out shoulder blades, that will also be, that is also, but not always connected with rounded shoulders. And it shouldn't be like that. So just for your, if you're not sure if your shoulder is stick out too much, if you're able to ask somebody to put the hand on their back, and their hand can easily slide under the shoulder blade, right? Then it shouldn't be like that, basically. So if you can just stick it around, and that's generally speaking, that would be not efficient. If you don't feel any tension and pain and so forth, hopefully you will not, but there's a big chance that you will in the future develop some kind of tension and issues, when the body just grows a little bit older. So definitely fix that as soon as possible. So building those muscles, both girls and boys, like, got to do it. Otherwise, the consequences is, 5, 10, 15 years later, or just not able to do full movement of some kind. So and last on this side, just maybe you experience a slightly or very irritating point on top of your shoulder blade, below your neck. That is also the reason behind it is also too weak back. So you can see that the common theme is basically we are not acting like apes. We just sit too much, and we should lift way much more weight with our back, which the best is weightlifting, and body weight training as well, but heavy enough. Cool. You guys follow?
Yeah.
We got one more slide, or maybe two, with those kind of issues. Does some of those issues kind of like sounds familiar to you, or you heard about it?
I have all of them.
You have all of them? Do you?
Yeah.
We can resolve that. All right, maybe you heard or you have felt yourself pain on one side of the lower back. That might be the reason behind it. It might be either one of your legs is shorter, and you'll be surprised by what percent of humans have differences in limb length. It's actually quite high. I don't know exactly, but a lot of people have basically one leg shorter. I know that one of my legs is a bit shorter than the other one, which then creates a different position for the hips, and that influences obviously the musculature and the skeleton system above it and fascia, like creating more tension on one side, which then travels to other side, which then travels to other side, and then suddenly you have a neck pain in the top back part of your neck and head, and it actually comes from uneven hips and one leg being shorter. What you can do over here is you definitely first and foremost always need to make sure that you're as mobile as possible in terms of like hips and shoulders, so you have the full mobility. That helps. And also weightlifting and training, but with alternate kind of exercises. So first one side, then the second one. First one leg, then the second leg. And not train more the one side that is weaker. You train evenly both of them, but just separately in a sense. That's one of the ways to do it. And another way to do it would be to basically engage in like more complicated compound rotation movements, also side to side. So yeah. We covered that. All right. Elbows. Also, we also mentioned, right, the issues with elbow that it actually comes from different places, like the grip strength kind of issue, which is located differently than the elbow itself. Yeah. This is it, I think, in terms of those elements. I think we covered most of the most common issues. Now, I know we kind of skipped around and explained generally. Now, if you have, because we can just really dive deep into each one of those problems and talk for 1 hour about each one of the problems, or explain it in detail. But I think what will be better if you have, maybe you don't, but maybe you have specific questions about certain aspects. Maybe you have a certain issue that bothers you or somebody that you know. So now we're going to have a little Q&A if you have those kind of questions, or if you will have any questions about the presentation so far. So I think we will be able to take a dive into that. So you start. All right, let's go. Let's hit it.
My question is...
Yeah, every time just use the mic, yeah?
My question is say you're having a specific pain point in your body, is there a way to identify which part of the fascia needs to be released in order to alleviate that pain?
Yeah, of course. That's the whole purpose of this presentation, to kind of introduce you that there's a system, right? So there's always a reason why you have that pain. It's not random. There's issue along the bond itself. Before or after, there is somewhere. Now, you personally, if you don't have the specific knowledge, then it's going to be a bit more difficult, right? Because that's why you study and you practice that thing. But there are materials on the internet that will give you the answer more or less. But the problem is that information on the internet is just, there's a lot of nonsense as well, so it's a little bit difficult. So the best thing you could, if you really are curious about specific subjects, to contact a specialist like me, or to learn about all of the fascial lines and treatments from trusted resources. Maybe there's on YouTube somebody who is like a therapist with great background that can basically explain it. But do you have specific example, for example?
I do. So I guess my question was more in, say I'm warming up for a workout.
Yep.
And I'm warming up doing a warm-up squat set, and
Yep.
I recognize that I feel some sort of pain in a specific area.
Yep.
that I might think is related to the fascia. Is there a way that I can say, okay, if I have pain in this specific area, say in between my hamstring and glute, that I need to then release this part of the fascia chain
Yep.
to alleviate that pain?
Mm-hmm.
Does that make sense?
Yep. So you have pain over there
Yes.
between glutes and hams?
Yeah.
Right. Is it more on a place where on a sitting bone?
No, it's more
Lower?
almost almost more medially into
Yeah.
my groin,
Yeah.
and only in a deep squat.
Yep.
And it's after I just trained legs last week. So
Only one time,
only one time, but one time I hadn't trained the legs heavy in a long time,
and now you felt it.
and now I feel it, and it's been a week of recovery after ice and heat. Even with that, it still hasn't released,
so-
even with my normal stretching and
Yeah. So
warm-up
don't
routine.
stretch it.
Yeah.
Yeah. Don't stretch it. It's not always smart to stretch stuff that hurts. There are cases where it's actually may damage it more. So if you had a overstretch on the gym, that sounds like that. So for example, you lifted something, maybe something didn't go along the proper movement. So basically, you overstretch a muscle, and you have the pain issue. The thing that you might consider is rather applying a pressure along the muscle, rather than stretching it actively, or rather statically. It's like let's say you lean forward and you stretch that thing. That's not always the best thing you do, but a little pressure along the muscle. So for example, using a little ball, like a massage ball, and you never across the muscle, but along how the muscle is built. So along the ligaments of the muscle, right? So the direction obviously over there would be up and down, that's it. And you try to apply pretty serious pressure, but not too crazy. You still want to be able to relax. And you think about it like you're trying to melt a very cold butter with your finger. You would apply the pressure, you would be patient, and you would just slide it alongside those ligaments or that muscle. And this is the same thing you would do with the ball. Not quickly, not aggressively, not the ball that has a lot of spikes, but rather patient movement along the ligaments and along the muscle, how it's built, and along the fascial pockets. And this is how you basically organize disorganized fascia, right? So if there's been some kind of stretch, rupture, some irritation, as long as it is not super inflamed, you're able to apply that kind of pressure, and like 9 out of 10, it helps. Sometimes though, if you damage a bit more firm element of fascia, like you basically overstretch a tendon, it will take some time to recover. It will take some time. So that's another thing to think about. If it doesn't go away, then a good thing that research also backs is eccentric training of that muscle. So in that case, you have hamstrings. If that's maybe that's abductors, but let's try hamstrings first. Sounds like it at least. Then you would do, for example, laying hamstring curls. So you lay on this machine that you are able to curl your legs, but you focus on the eccentric movement more. If that would be very painful, then you would have an assistant that brings the weight up, and then you would apply only the eccentric part of the movement. So basically you stretch and you kind of like force the muscle to work. So research shows that that's actually great for recovery after that kind of injuries. So yeah. So in your case, massage ball alongside the ligaments. Don't be fucking crazy about it, so don't push it too hard. But at the same time, it's a place where you actually have to go pretty deep to reach it. It is not the easiest place to do it. And if you don't have your own practice on how to move your body, so you can, auto-massage yourself with the little ball, then it will be difficult to reach it, right? So over here, oftentimes step in, again, like some kind of manual therapist that can help you out and stick a finger basically there.
You'd like that, wouldn't you?
Yeah. So if you're up for that attraction, then yeah, call somebody else.
Right now?
No, but like seriously, then you would use the help of a therapist, and the eccentric kind of movement, eccentric training shows great results.
Okay.
Yeah.
Thank you.
And do not stretch it statically. Yeah. Cool.
I can ask a question. It's like super personal, but maybe someone else has the problem. So when I stand up, I have been to so many, I don't know, physiotherapists and stuff, and like my shoulder is always like too high. I don't know if it's like from sitting.
You mean one of your shoulders higher than the other?
Yes.
Yeah. Do you have scoliosis?
I don't know.
Yeah, we can check that. Probably we can check that later.
Yeah.
But basically, you may have scoliosis. So
Okay.
so your spine is basically a little bit like a little S twisted to the side, right? And that's one of the reasons why one of the shoulders is higher. One of the reasons can also be like one of your legs is shorter, again, tilting the pelvis, and again, having this slightly scoliosis in a sense. So that's one of the reasons. Might be also it's a habit thing. So muscles on one side of your body is basically much stronger, twisting your body and your shoulder forward. I had personally that issue with that. So my shoulder was much more lower and forward than the other one after I broke my back. So I had big issue of correcting that. And I had big differences in strength of my body, side to side comparing. Solutions for you, definitely mobility exercises that basically will apply to everybody listening anyways. So it's a dead hang. Dead hang is basically you hang from a bar like a monkey as long as you can and you squeeze the bar.
Yes.
Super powerful exercise, and do not underestimate how simple it is. From the perspective of biomechanics and functionality and like fascial treatment, it's super powerful to just straight up be a monkey or ape, really, and hang from a bar, squeeze the bar, and if you can hold deeper, then it's even better, because then you increase even your grip strength as well, which also bulletproofs your elbow and shoulder as well. But hanging, that would be one thing. Second thing, deep squat, so Asian squat. You know what Asian squat is?
No.
Sit like an Asian, So it's like, so basically, ass to grass, knees out, straight up over here. That's one of the things, and most people never do it, but that's actually the original OG position to sit. So if you would, if you need a little wee-wee, or you would eat in the past, you would sit in that position as a default, and this is like human sitting position, right? Like a little monkey, or this is our original way to sit, but we don't do that anymore, which causes a lot of trouble. Did you know, by the way, that in Asia in general, there's significant, by high percentage, less issues with lower back, with people like, herniated disc, problems with tension in the lower back, problems with they just don't fucking have it. It's a phenomenon for the Western world, more or less, because, they sit deep in deep squat position. So it fixes the posture. So it's very interesting, actually. So that's one of the things you need to remember as well. Another thing is Cossack squats, or basically, if you imagine that you're sitting in that deep squat, Asian squat. So Cossack squat would be if one of the legs would be straight to the side, and you lift yourself up and then down on the other side, right? So basically, you stretch the insides of your groin. It's also a very powerful thing to do. You basically lean forward. You can put your hands on the ground or one of your knees. One of the legs is bent, and put it a little bit out of the body, and the second leg is straight to the side, feet pointing up, basically like a little ninja style. You stretch the groin on the inside, and you'll be surprised that I'm guessing that you will feel stretch. If you have those kind of issues with one shoulder up or down, maybe you'll feel a little bit stretch on one of the sides, maybe not, we'll see. But first of all, you have to mobilize body by those exercises, for example. And second of all, you have to lift and train the body, because muscles and ligaments together, we kind of separate it here, but basically all the muscular system and fascial system together will create the correct tension around you, right? So it can stimulate where is your shoulder put. So is it back, is it forward, is it to the side? So you can, by training side to side, alternate between sides, and training whole body with weights, you can adjust the position of different skeleton elements. So in your case, proper mobility routine and the proper full body workout with resistance training, so weightlifting, that's the easiest. It's a solution for you. And if you haven't got help from any therapist, it's because, I don't know. It's, I do. It's basically not forcing you to implement those kind of routines over a long enough time to change your posture and your skeleton. And also, the older you get, the more challenging it might be. So sooner the better. So the common answer to most of the issues will be basically mobility routines and weightlifting, really. So that's that.
I have a related questions, kinda. So I had surgery on my right ankle, and it's always the right side that's like kind of like hurting and stuff. And I've been told that I'm also a bit like not aligned. I think
Yep.
my hip is like this,
Yep.
basically. So, like, how can I reorganize my fascia, because it's always the right side?
So to all of those kind of questions, answer is similar actually. So you need to think about that. Let's say that human body is like a piece of blocks on top of each other, like Lego, and you want those blocks to be aligned, right? If some blocks is put to the side, then other blocks will also start to fall apart, right? So your job is to create the right combination between the mobility, so how long are different parts, right? And how much you can move them around, and strength as well. And the equivalent of that means correct mobility, again routines, the same one as we described. So basically adjusting the mobility in your hips and your shoulders. And if that is in check, that's great, but then you have to multiply that by correct weightlifting routine, and that implements all directions in your body. So front, so you push things, you drag things, you push things up, you drag things down, you rotate your body, you bend forward, you go up, you do squats, you go up, you train also each body separately, and challenge in this way. And in this way you kind of adjust the whole structure of tension and those R elements as good as you can. Sometimes if you're like really is super short, then you will not fully be able to obviously be perfectly aligned, and this is just the way it is, but you can always improve. And in your case, for example, implementing much more weightlifting and building muscle around your body is the solution again. So adjusting that. So for a lot of people that are not into gym training or bodybuilding or calisthenics, like proper techniques, it's the common issue is basically not enough muscle around your body, or rather not activated enough, not good connection enough. So the solution for your mobility times weightlifting or resistance training. Yeah.
And just about the stretching part, like I've heard a myth about the fact that if you stretch right after you like worked out, then it's gonna like hurt the muscles. Is it better to stretch right before or like 3 hours after?
Never before.
Oh, after, sorry. After or later?
The best way is to do it the other day, to be honest. In my own experience, just not the same day. Now you give impulse, one kind of impulse to your body, you train basically, and that's it. What you can do implement, for example, especially with legs, if you train heavy legs, then you might want to consider a slight stretching, maybe dynamic stretching. Dynamic meaning not that you're keeping one position, right, but you maybe, move and do dynamic stretches. So swing the leg, for example, and also apply the roller, right, to massage yourself after the training, because that helps with like soreness in some cases. So that could be great. But if you want to do like straight up stretching, then probably you would choose the different day. But also you need to differentiate between stretching and mobility, and it's not necessarily the same thing. So if I want to, let's say, stretch my quad because I have too much pressure on my kneecap, or I am aware that my quad is too short, right, the front of my thigh, then I would definitely take a position and massage it with roller, warm it up a little bit, and then I would lay on my belly, put the roller under my knee, put the feet closer to my butt cheek, and in that way stretch the muscle. And then I would later, because the purpose of that is to make that muscle a bit stronger, stretch it out, right? The mobility, though, may look differently. The mobility is more like your ability to move around, to the full range of motion without pain. And that's more like a dynamic drill, more like a movement where you're able to do deep squats up and down. For example, hold your toes and ass to grass, and then up with the hips, right? Back and forth, back and forth, back and forth. And for the quads, for example, swinging like back and forth, back and forth, back and forth. That's dynamic stretching, right? So that's more like mobility stuff, and stretching is the different stuff. So sometimes you don't want to actually stretch a certain body part, depending.
Okay, thank you.
Yeah.
Hello.
Hello.
So I wanted to ask you, what is the most common pain that clients come to you with?
Existential.
All kinds?
No, it's your story. We have chats. No, but seriously. No, lower back.
Lower back.
Definitely lower back. Just lower back issue, but the solution is quite simple. We start training and then it goes away. Obviously, correct way, but yeah, most of like discomforts and issues is solved by simple mobility routines and regular training with weights. It doesn't have to be. I mean, it's even not advisable to like do super heavy weights, but that's a sport on its own. But I'm talking about good resistance training, and it solves everything. Like especially lower back is just you need to think about the lower back issue is basically body collapsing under the gravity, right? The body just collapses. You're not doing anything with it. It just dissolves itself and just like falls forward and drains you with energy and gives you pain and stuff. As long as you start training, especially back chain, then suddenly everything is like appear better.
Yeah.
More energy, you sleep better, you have your better mental state. And it influences also your hormonal system. So more testosterone, more growth hormone, everything is being renewed and everything starts to work. So lower back issue is the biggest problem because it is the center of the body. So that's the most common one. And existential one. But
There you go.
actually, it's funny because that one also is resolved when you start training, many times at least. People are feeling bad and they work out and like, it's not that bad.
Yeah. And from the physical pain, how long of a time frame are we talking about? Let's say the lower back pain.
Oh, it can be very different, it's individual. So it depends. Maybe forever you will have that pain anyways, you will just minimize it. Or you will solve it within 1 week. Sometimes I have people that have pain, for example, in lower back, 1 point, or knee, and I'm able to solve that for them within 1 hour of activation properly. So even shorter sometimes. And so it can be super short or super long depending on the issue and individual and genetic potential and so many factors that it's not possible to give straight up answer. So
Thank you.
cool.
Mateusz, thanks very much for telling us all the fascinating stuff about fascia, first of all, and sharing all your knowledge. I have a very important question because this is for my good friend. He's been experiencing a lower back pain on the right side after paddle. And I wanted to ask, how he can release his right side of his ass cheeks.
Actually, that's a great question because I guess I forgot to cover one of the most common pains, actually. That could be in the presentation, and that also, You have it in the ass cheek on one side?
I think it's more on the right hip, a bit higher, not in the cheek.
Yep.
But I think like I have a few things now. That's why I was not joking when I said that I have everything.
Yes.
All the problems that you listed.
Okay, so 2 elements when I'm answering that is going to be this. First of all, and again, a little fun question. Do you want to know, and I'm going to segue back to you in a sense, but do you want to know who or what's the demographic for the major percent of Achilles tendon rupture?
Demographic.
So we are talking about, we have, all Achilles ruptures history. What group takes the big chunk, biggest percentage of
Male.
of that?
Do you know?
Male, yeah.
I would say...
What age?
Age, I don't know exactly. Probably somewhere like 31 to 35, I guess. But I would assume it's men who, after years of like middle age, basically, because it's men who maybe spend a lot of time in the office or in their career, and then they realize, I need to go back to sport. I want to play soccer again. I want to feel young, and then bam.
Exactly. So it's usually men who are, understanding that the body doesn't last forever, and they, shit, okay, I will start training. And they go aggressively into something that is fun because they think gym is boring, which is fair. I mean, it's not, but I understand it. And they go into sports because, it's good for your health, right? You train, but your fascial system is not used to it. So you don't play paddle, you don't play paddle, you don't play paddle. and then you suddenly play a lot of paddle. And your body is like, what the hell? And the tension around your fascia is not adjusted to that, the tolerance to it. So that's why you will then possibly injure, damage, overload. And this is the reason why you should always move around, not wait for it forever. But yeah, and if you're doing certain movements like that, you rather, for example, to use a different example, running. If you have not been running for the past 10 years and you suddenly like, okay, I want to do the marathon, and if I can bang on a first run 20 kilometers, you will damage your body most likely. Like your body is just not adjusted at all. So you would rather, first of all, do a nice warm-up routine. You start with a 1K, maybe 2K, just take it easy, or really slow tempo, and you really listen to your body and gradually increase more, because your fascial system will adjust later than your muscle can. So the fact that you can run around with the paddle aggressively, like physically you're able to move around like that mechanically, like it's available to you, does not mean that you have to, you should, in a sense. So you may, you're risking basically damaging the body suddenly because your body is just simply not used to it. And it can be split of a second, it can be silly movement, it can be something small, right? If your body is not used to it, if you have not been moving around, jumping around, dynamic change of motion, direction, and everything like that, then suddenly, and sometimes you may be active already and it has nothing to do with that, but it's just you've been unlucky, that body part is not fully warmed up, it's just not tolerating that. So that's definitely important to not only do simple movements at the gym, but more compound, complex movements. And if you're exploring new areas of dynamic movement, then rather you start easy and then dial in more and more eventually. But still, you still, anyways, can always happen some kind of injury. So so that's that. But
one of the silliest injuries I had is a groin strain.
I'm not sure if that's the space to talk about,
Yeah, but
those.
I literally just rotated towards a remote controller. So I was reaching for the remote controller and I got injured. I know.
Damn.
I know it sounds crazy, but it's true.
It sounds crazy, but sometimes, I remember I grabbed a girl, I hugged her and wanted to lift her to the other side, and I ripped her abdominal muscles on one side.
Wow.
And it was not aggressive movement at all. It was gentle, but it was just this. It was just just perfect alignment for horrible situation to happen. So it happens.
But
to answer your pinching issue with your butt cheek or rather hip, maybe it's just overload to the joint itself. If you're just going to rest a little bit, it's going to regenerate itself, and that's good. If it's going to continue, you can apply pressure again, little ball or rather roller on that actually element, and alongside, but not too much, because that pain, that area of your life always is painful, and it's supposed to be painful because the tension, the side lateral line is supposed to be tense, so you will feel tension over there, anyways, or like a little discomfort or pain. But you can apply it if it doesn't go away. Maybe it's some of the tissue over there that is being overstretched. I would explore that. If it would be butt cheek, you asked me before the question, what's the most common issue? Another funny statistic, more or less. To be honest, I don't remember exact percent, but it's something around 90-95% of times when people ask or say, I have a isha. Is that the word in English? How do you say?
Issue. Oh, you mean sciatica?
Sciatica, yeah?
The pain,
yeah.
The pain from
yes,
the
so basically, yes,
so
the lower back pain that goes to leg, sciatica, is it the English name? Yeah. So a lot of people think that they have that, while in reality, big portion, like 9 out of 10 people, they actually have something else, which is a syndrome of too tight rotators of the hip, which lays under your butt cheek, deep inside over there, one of the muscles, piriformis, depending on the genetics, but it basically goes very closely to the nerve that goes there. By the way, the nerve over there is very thick, like a finger. And if that muscle, because you sit too much or because you're just rotators, external rotators, so when you do with your feet like that, It comes from your hip or or the muscles in the back of it. If they are too short, they will actually put the pressure on the nerve, and they will result in either like a pain in the butt cheek when you drive a car, for example, or when you sit too long, and it might also spread to the leg underneath, like to the knee and lower. And it's actually not ischial, and it's not sciatica, but it is basically piriformis being too short and putting pressure on the nerves. And the easiest way to do it is to, how to describe it, you would put yourself on the floor, you would lay on the floor on the back, next to a wall, and you will put your feet, flat feet, on the wall, like almost like you sit on a chair, right? Like 90 degrees kind of position. And then you'll put one of the legs, without moving the other leg, one of the legs you would put the foot on the knee, basically put one leg on top of another, and more or less over there you would find that the butt cheek on this side is being stretched. And you can adjust a little bit the position, but basically that's the starting position, where you start to stretch that piriformis muscle and other tissue around it, and releasing in the end the nerve, right? That's one thing. Second thing, either you would find a big ball, like a big hard medicine ball. Actually, I'm not sure if they call medicine ball. The hard one that usually you do to exercise, for example, abs, right? You know, side to side kind of twists. So that ball, you would sit on it with an angle 45 degrees. You would find that spot that hurts the most, and you would go rotate around it. As you also do the same kind of movement, so you would also put the one foot on top of each other, another, and over there, but also you would explore a new level of pain, because this position is pretty bad. But it would resolve the issue pretty quickly, actually. But again, the rules is you don't go crazy, right? You don't smash your body like that, so you need to adjust a little bit the pressure and go deeper, 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 deeper. Or you can alternatively use a roller and do the same, but it's not as effective because the way it's shaped is better. It's just a bit more rounder kind of surface. And on the other hand, if you would have a little tiny ball, it is too small. It will go deep very quickly, and you will feel a lot of pain. So yeah, it's not good because you will tense up while you're supposed to release, right? So yeah.
Yeah, first of all, thank you, Atlas, for asking that question for me. And just in one of the slides where you were talking about the blue lines, right? There was the spiral line, which is responsible for like rotation,
Yes.
right? I'm pretty sure that I have something there, because when I look at all of the different kind of issues that I have, left ankle, left knee, right hip, right shoulder. So it's almost like an X.
Yeah. So this is exactly what I'm talking about. Everything is intertwined and connected together. So yeah, it goes around like a spiral around your body, the tension. So you have something, yeah. It might be, for example, and we know that there's something wrong with your foot, right? That affects your knee, hip, lower back, mid back, shoulder, neck, and it goes, travels, yeah. Solution, again, yeah, in your case, there will be maybe some further treatment of the ankle, but for those who doesn't know, like, basically, if that would be a question out of the blue, I would say, again, you need to mobilize every part of the body. If you have certain issues that are still painful and you're not able to resolve it with mobility or eccentric exercises, then you would have to contact a therapist or teach yourself about the treatment on how to, adjust the tension of the fascia. If for some reason that would not work, then maybe there's some mechanical damage that is you're not able to fix it. So then, the next procedure would be operation, but that's very far away. So for example, the one little beef that I have with a lot of approach from a lot of doctors and surgeons is directly from issue to medicine. If that doesn't work, operation, and there's nothing in between. And sometimes they will send to a physiotherapist, but that physiotherapist uses the old methods, the very general movements that are basically worth like very little to the body, because they don't have that same kind of like angle toward the body from manual therapy perspective, from fascial bones perspective. So it's super ineffective. So it's very like weird because, and patients they don't know better. They don't have information, so they go to doctor because it hurts. You get a couple pills, it doesn't work. Well, we're gonna cut something off and we'll see. And it's fucking crazy that it's still like a big portion of the medicine works like that. So yeah, somewhere in between, there's people like me that can resolve a lot of issues, more, like much more than one could expect. And hopefully in the future will be more presence of people like that, like me, in the medicine world, because it's just not.
Yeah, I can definitely confirm that. Unfortunately, I had the chance to visit so many different kind of physiotherapists in different countries, and everybody was talking about biomechanics, but nobody has ever mentioned anything about fascia.
So biomechanics is one thing, and the knowledge of the myofascial like bonds and the fascia itself is the thing that basically like uses the biomechanic rules, but it's a thing on its own. So yeah. And for those of you who don't understand biomechanics, it's basically like physics. Like you would have, like a dead robot that has some kind of engine that moves around the bigger parts, and that's mechanics, right, of that thing. Biomechanics just applies to organic creatures, everything that runs on muscle and tissue. So basically all animals, sorry, not all animals, but most of animals that we think about, like for example, like an elephant, horse, dog, is all constructed in a similar way as we are. So.
Just as shortly we are coming to the end of this session, I would have one more question. So we all know that everybody is very busy, right? So let's say that you have 5 hours in a week to spend it on yourself, and I don't know, you go to you go work out, you go for running, you stretching, you do whatever exercises. Like, how would you spend that 5 hours between the different kind of things that you can do for your health?
Bro, 5 hours, it's super enough. People don't realize that I don't have time training. Check your phone and check the screen.
Screen time.
Screen time, and see how much hours goes into this and that. Like 7 hours, 8 hours on screen. You don't have time. And 5 hours. By the way, in 1 week there's 168 hours. If you use 4 hours out of that, you already entered a more advanced mobility and weightlifting program at 4 hours, right? It's already like middle of like, you can go also advanced, like properly, let's say 5, 6, up to 7 hours, let's say a week, which is, extensive, but 5 hours is like a lot. So people don't, whenever people say, I don't have time to train and stuff like that, my head is too busy, stuff like that, like they just don't have system around it, and they have this illusion that they don't have time, but in reality, they're just super inefficient with time. And that's a different issue. It's not like you have time issue, you have productivity issue. So resolving that, and this is also how I work with people like that say, I don't have time. They're like, perfectly, let's book a time with me and we will find the time.
Right.
Right? So to answer you, the best, like a recipe that I found that works for most basically, is I would say the typical human being, whatever male female. There's slightly different exercises for male female, but more or less the structure is the same, and that would be about 3 hours a week of weightlifting. When I say weightlifting, I'm not talking about super heavy stuff. Adjusted to your level, obviously, with progression, and following a specific program, not a random program. We just learned that human body needs tension from all places. And if people just follow random program, or rather just show up at the gym and then wing it, or go to a group classes, the issue with that is that those are not adjusted at all to their personal body. So it might be that, for example, you have deficiencies in the back chain, right? Like most people have, and you go on a group session and there's nothing about it, but there's a lot of push-ups or like jumping around, which is not very good for your body. As well as if you, for example, just randomly wing in the workout at the gym or home, again, then you just choose automatically your favorite exercises. You avoid this other icky exercise because you don't like it. And you tend to follow into basically this trap where you just do a couple of movements with your body that you like, that you feel all right, and you forget about certain other aspects. And then you go and play paddle, and then you have an issue. And, no.
This is about me.
No, but basically 3 hours, 3 hours a week for a person who is not into that training that crazy. Then, yeah, total body workout would work, I think, or at least push pull kind of, and legs. if you're not into like bodybuilding, it's fine. It's more about the compound movements with the weight or your own body. It's also fine to do calisthenics. So calisthenics means without like proper gym equipment, but rather with your own body, bar, and body weight in general. You can also do that. It's totally effective. It's a bit different training. I would actually argue that it's beyond the basics. It's a bit more advanced form of training for most people, at least, because it's easier to develop certain like irritations in certain joints. But not necessarily if you just stick to the basics. Basics in calisthenics, push-ups, pull-ups, air squats, dips, stuff like that, simple stuff. But to answer your 5 hours, let's say we have, so I would put 3 hours of workout, like weight training or body training. I would add mobility routines. I would spread it around, so either every second day or prior to workout, depending also on your genetics. If you're very stiff, then you would need to do more. If you're older, you would also need to do more. If not, then if you're super mobile, then sometimes you don't really need it. You rather need more strength training, building muscle. I would also use one of those hours to prepare and make sure that you have enough nutrition. So people say, I don't have time to eat well. Well, then fucking find time to design the week where you eat well. It's not that fucking rocket science. And most of human beings eat between 7 to 9 products a week. And that consists of 95% of what they actually eat. So you change those and you change basically your body, because you are what you eat. Think about also that every 7 years, your body is 100% new. So every cell is dead and gone, and everything else is new. You're a new human being every like 7-ish years. That might be, depend on what's your age and stuff, but So weightlifting, 3 hours, mobility, maybe 1 hour spread across week in form of 10 minutes routine is good enough. What kind of movements? Dead hang, deep squat, Asian squat, Cossack squat. So again, this Cossack squat is kind of like, one leg bent, one leg straight. You go up with the ass, you go down on the other side. Jefferson curl as one of the best exercises to build up the power in the back. Jefferson curl is an exercise where you stand on some kind of elevated structure, so step or a box. You hold the weight in front of you, and you start with your head, you bend it forward, and you basically fold gradually until you reach to the bottom, wherever that is for you, because it's depending, and then you climb up again. Basically, stretching and strengthening the posterior chain. It's worth to do it correctly. So YouTube over here is your friend, or obviously hire me as a coach. But the proper execution is very important, and in the beginning it might be confusing. But basically, a Jefferson curl is one of the best exercises to actually, What I'm saying now, the specific exercises, those are the top, the best that I found is the most efficient. And some of them are so freaking simple, it hurts to know that people are not actually doing something about it. So for example, Asian squat, it's probably resolving 60% of issues in your body in terms of tension and pain, right? Just this one little movement. One. And then second, you would add dead hang, and you're already freaking 80%, like 90% gone, all your issues with your body, right? In terms of unwanted tension, I guess, at least. And Jefferson curls on top of that, man, we're already super, super nice. Really, it's not that difficult once you know what the recipe is, right? Most people don't. But this is it. What else? Rotations to the body is nice. Stretches where you rotate your body. If you look at the screen, I think there was one picture of, there we go. This rotation, super nice. So this other knee is on the floor. I have both of my hands in front of me next to a wall, and next to that I take a breath in, and then I rotate my body without moving my left knee. So I rotate it out of the wall and try to touch the wall on the other side of me, rotating my body and breathing out on the end. That's a very nice exercise to basically stretch those bones that goes around the body. That's one of the examples. Again, to summarize, 5 hours a week, 3 hours spent on weightlifting or body resistance. For most people, gym is still the best place to do it. It's a specifically designed place to train your body. It's like, if you don't like gym, freaking start to like it. Like, I don't know what to tell you. Like I don't like gym. Well, maybe you don't. Maybe you can find other solutions like calisthenics, training home. That's fine. But it is specially designed place for you to do certain movements, and other places are difficult. So, for example, back training, which is generally speaking the most important from the perspective of function, difficult to do it on your own. Difficult to do it when you're inexperienced on your own at home. It's just not going to happen. Like, you need equipment to start you going with, like rowing and like lateral pull downs. Yeah, it's easier if you're more advanced and you already know what you're doing. Then yeah, a bar and a dip station and you're already good. If you know how to move your body, then yeah, it's gonna be easier. But for most people, it's just, yeah, it's not gonna happen. Follow a structure again, and deep squat, Cossack squat, hang from the bar. Oh yeah, and one very important exercise is, and I generally have a list of those exercises that I send to my clients, but that consists of all of those. But one of the exercises that are super nice is, it's called upright row with external rotation. All right, and what it is you stand and you have two little weights, and you basically drag your elbows to the top, like 90 degrees from the shoulder without lifting your shoulder up. You would drag them up here while it's still rotated on the inward. For the people online, if there's somebody still over there, rotate over there, and then you rotate it backward without changing the angle between the arm and the body, so it's still 90 degrees. And you rotate it back, and then you go forward, up, and then down again, and then up, and then like that. And this exercise performed on both sides is a super nice way to strengthen your shoulder. That coupled with that hang, and you're golden. Like, it's really not that difficult to be healthy, but you need to know exactly what to do at what time, and yeah, that is a bit more difficult. But, yeah. But that's why I'm designing. Adam knows that I'm designing a course and a community that basically consists of all the library of step by step, because I think it's just simply missing in the world. You have all those crazy workouts on social media that has nothing to do with reality of like having healthy functional body, but are presented by very pretty people that are ripped, so we buy in. Yeah, we'll see.
Yeah, amazing. So if somebody wants to reach out to you or learn more about what you do, how can they do that?
Yeah, you can stalk me on Instagram. Yeah, it's on the bottom somewhere there, Mateusz Wojtowicz. You can, if you would like, you can apply for a one-on-one coaching. I train people on functionality and basically being healthy, adjusting the skeleton system, the fascial system, helping you out. Directly, it's much easier to talk about somebody one-on-one. Or if you want to transform your physique from like, yeah, maybe a little bit too skinny or a little bit too big, and you want to change it into something else, build muscle, burn fat, then we also can do that. As well, like I mentioned, so I'm building this fitness video course, basically full A to Z, full library of what's in my head about human body distilled into a step-by-step process to master your body, and that mixed with community and weekly calls. That's going to be coming up soon, but if you're interested in that, let me know, because soon it's going to be paid. Still, its entrance is still free, but it's not going to be free in some time from now, once it's at more advanced stages. Once you get in, then it's free forever. And if you want to get in touch, then Mateusz Wojtowicz on Instagram. That would be the easiest platform, I guess, to keep it simple. And yeah, thank you for listening.
Thank you.
Amazing. Thank you so much. I'm going to take the camera back just for 1 single second. And okay, can you stop sharing? Alrighty. Yeah, and what I can tell you guys is that Matt has been helping me with a bunch of different kind of things. Not just with fixing my different kind of issues with joints. He's also helping me to learn how to engage my core, which I didn't even know it was an issue. And he has been giving me very painful massages, which can be very enjoyable as well if you're a bit, if you're into that kind of stuff. Anyway, so I'm going to upload this recording to the community under the classes. We are going to put there all the different kind of links for Matt and for his Instagram and his upcoming community as well. Highly recommend for everyone to check that out. And yeah, thanks again. It has been amazing. I think we all learned a lot, and we are going to do more of this kind of stuff and collaboration in the future as well. Thank you so much for joining, everyone. And yeah, I see you at the next one.
Thank you, guys.
Ciao.
Bye-bye. Thank you.